Hey, good evening, everyone. Welcome to Gut Over It. It is Friday night, and I've got my good friend, Dr. Kike Wiss here.
Hello.
I'm so glad to see so many people on tonight. So whether you're listening live or you're on the replay, enjoy it. Put in the comments. Definitely give us some likes, give us some love. And tonight we're going to be talking about
Got over it, my tummy on fire.
My tummy on fire. I'm Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. I'm also a functional medicine provider. We are here this evening with my good friend, Dr. Kike. She's also a functional medicine provider. Kike, I'm going to let you take the stand a little bit.
Okay, so I'm Dr. Kike Aduba. I am a functional medicine physician, and I help people mostly with thyroid issues and autoimmunity. So I do a lot of health coaching, and I'm a big patient advocate. So
thank you so much for being here tonight. This was not planned. You're welcome. We decided to have a little girls' dinner tonight to powwow about Clubhouse, about stocks and investments, and being, female entrepreneurs,
business growth,
and so it's been a fun evening. And she was going to be here, and I said, hey, join me, let's do this together. And she's always down for everything, so that's how you know when you got a good friend. She's like, okay, hold up, let me just go put my makeup on, we're doing this.
I've got you, right?
I know. So Kike is going to be interviewing me tonight so we can talk just a little bit about gastritis. And so we call this lecture Tummy on Fire.
All right.
So
Dr. Viv, so gastritis. Can you tell us a little bit about what gastritis is for those who don't know?
Okay, so gastritis really is just inflammation in the lining of the stomach. Okay. So, everything in medicine with an itis means inflammation, right? So gastritis is just inflammation in the lining of the stomach, and can cause, it's very common. So when a lot of people get endoscopies, upper endoscopies, most of the time the GI doc will say there's some degree of gastritis. So it can be mild, moderate, severe, and there are many different causes to gastritis as well.
Awesome. So from what you're saying, most likely we're all walking around with some level of gastritis. It's just a matter of, how bad is it? So what are the different causes of gastritis that we need to be aware of?
Okay, that's a good question. You had gastritis, didn't you, Kike?
Yes, I did.
Yes, you did. We won't talk about what type of gastritis she had. She had a different kind of gastritis.
Different kind of
alcohol, no, she's not. Is that water? That's not water. That's vodka. Alcohol is definitely a cause of gastritis. So I think that's the one where, people go out, they drink a lot, and the next day their stomach is on fire. So that because alcohol causes direct toxicity to the lining of the stomach, and so that causes a lot of irritation. So anything that causes irritation to the stomach will cause inflammation to the stomach. So alcohol is one. But another one too is medications. So if you're taking things like aspirin, Motrin, Aleve, antibiotics will do it as well. Or any medications, even supplements sometimes that we were talking about have those binders and fillers, and people are like sensitive to it. Those are some very, very common causes of gastritis. So I'll definitely say alcohol and then medications, right? And then there's some other causes that are more significant, like we know there's a bacteria called H. pylori.
Yes.
And that too will cause gastritis.
I was going to tell them that's the cause of my own gastritis.
No, you don't have to disclose everything online. You don't have to disclose everything online.
Yeah, but I want to talk about it quite a bit.
So H. pylori is a bacteria that loves to live in the stomach. Yeah, and it can live in the stomach for a really long time. So you can have H. pylori for months. Some people even have it for years, but they don't know that it's going. They have it. So some of the symptoms of H. pylori are just epigastric pain, bloating, nausea, dyspepsia, heartburn-like symptoms. Those are some of the causes of H. pylori. It's so nice to see everyone logging in. It's awesome to see so many people on. Please go ahead and leave some comments for us so we can see. The word of the night is tummy on fire. So go ahead and leave some words on, leave some comments on there for us if you were enjoying this. Go ahead and share some love, hit us with some likes, and we're going to dig right into this topic, okay?
Right. Yeah.
So Kiki, we were talking about H. pylori, which is a bad bacteria, and if left untreated, whenever we do an endoscopy and we take biopsies,
Right.
we look for H. pylori.
Right.
And if left untreated, it can go on to cause erosions, which are like little scratches in the stomach,
Right.
ulcers. And if you have H. pylori for a long time, you can actually get stomach cancer.
Right.
So it's one when we
Right.
find, we want to definitely treat. And the way to
Right.
treat H. pylori is ideally with antibiotics, right?
Right.
For about 10 days. And then we can check with a breath test to make sure that it's successfully eradicated.
So we already said antibiotics can cause gastritis.
True that.
And then to treat some
With H. pylori.
You have to use
So
them.
that's why you want to go to a good doctor, GI,
Exactly.
like Dr. V. So as a functional medicine provider, I'm well aware of what some of our conventional therapies can do. You know, we want to heal the stomach, right? We want to kill the bacteria, but
Right.
sometimes in doing so, we cause two problems, right?
Yeah.
A lot of people who've taken medication for H. pylori will say that it's pretty harsh.
Right.
How was
right.
your experience?
So from my experience, I had this horrible taste and sensation from my mouth
The
down to my
antibiotics,
stomach
yeah.
from the antibiotics.
Yeah.
Remember, I had to take proton pump inhibitors as well.
You have to take a
along with
PPI,
that. And
proton
so
pump inhibitors.
I
Yeah.
felt the impact of that, and
Yeah.
for 10 days, it was just an off feeling, but
Okay.
I felt good. I felt better afterwards.
Yeah.
So,
Yeah.
you know,
You have to weigh the good with the bad. So I
Right.
typically in practice will put patients on NAC, which is N-acetylcysteine.
Yes.
And so this is more from a functional medicine provider perspective. We've seen studies that show that if you give patients N-acetylcysteine, which is actually like an antioxidant,
Right.
with the treatment, it works better, more
Right,
success.
right.
And after treatment with antibiotics, everyone goes on a probiotic.
That's
So I
right.
like to leave them on a probiotic for at least a month, if not more, and then paying more attention to the diet. So kind of
Right.
taking care of the body after the treatment. And something we know really works well, and Kike, you brought this up, was actually L-glutamine.
Right. And
So-
that would be prophylactically before you get on the antibiotics.
I
to
usually,
help.
you could do it before
Okay.
antibiotics, but you could probably even do it throughout the course.
Right.
Before, during, and after antibiotic, because we know that L-glutamine is a great protein
Right.
that helps heal the lining and restore the lining.
Right.
So L-glutamine and zinc are usually therapies that we'd like to continue patients on after treatment.
So we
for-
talked about probiotics earlier
Yeah.
as well. Now we've taken antibiotics. I thought we'd take antibiotics and then the probiotics. right?
Exactly. So you
Okay.
would take all your antibiotics first and then take your probiotics
after. Okay, that makes a lot of sense now.
If anyone's got any questions about gastritis, let us know. Please type in tummy on fire. I see you guys on. That's awesome. So let me talk about some rare causes of gastritis that sometimes we'll see. So there's one called autoimmune gastritis. So this we will look for in people who tend to have vitamin B12 deficiency,
Right.
because their antibodies being formed to intrinsic factor, right, which helps get vitamin B12 out of
Into the
food.
food,
Yeah.
yeah.
So when we notice vitamin B12 deficiency, we ask, how is your diet? Do you eat meat? Are you vegan? All those regular questions like
Exactly.
why you could be B deficient. But then very often the primary care doctors will refer over and say, test for autoimmune
Right.
gastritis. So when we do biopsies, your endoscopist can't tell with the naked eye. So it's your
Right.
pathologist who gets the tissue and can tell that, oh, this person has a different type of gastritis called autoimmune gastritis. And what's really interesting about autoimmune gastritis is that it usually leads to hypochlorhydria.
Yeah, right.
So
And what is that?
hypochlorhydria, you tell me, what is that?
That's low stomach acid.
That's low
right?
stomach
Yeah.
acid,
I just wanna
exactly.
make sure
Yeah.
people who don't know
That's
what
low.
that is.
So
Yeah.
that's low stomach acid. So if anyone can type in, Dr. V, I like those spelling bees, right? So if you can type in hypochlorhydria for low stomach acid, go ahead and type it in. So low stomach acid is abnormal because the stomach is actually supposed to produce acid. That's its job to digest food, right? And so when you give patients PPIs, right, when patients are on proton pump inhibitors for a long time, it reduces stomach acid. And what we see with autoimmune gastritis is that just that autoimmunity naturally just reduces stomach acid. And so these are people, when I see them in clinic, you know, their primary cares are like, I put her on omeprazole, I put her on these medications, but they're not getting better. It's actually because they actually need acid, right? So we would actually put them on betaine HCl, right? Betaine hydrochloric acid. And this is something I think I do differently to a lot of GI doctors. When I go in to do an endoscopy, I test the pH of the gastric juices. And if the pH is greater than like a 4, 5, that means they are hypochlorhydric because the pH of the stomach is supposed to be between 1 and 4.
I remember that was one of the first things you mentioned to me, that the pH in my stomach was fine. And that was fine. Quite a bit of comfort,
yes, absolutely. So hypochlorhydria and autoimmune gastritis, you know, that's another kind of gastritis. Let me see if there are other types of gastritis that we haven't really mentioned. For the most part, those are the most common types of gastritis. We'll sometimes see gastritis when something else is going on in the GI tract, like if someone has bacterial overgrowth. We'll just see general inflammation everywhere. If somebody has celiac disease, that would also lead to some kind of gastritis. And then when some people have allergic, like they have allergies and stuff, like allergies or sensitivities to food, they'll have what we call an eosinophilic gastritis, right? And so that is usually treated with elimination diet. We start eliminating to try and figure out what's going on. So, you know, the bottom line here is when you go see your doctor and you're complaining of stomach pain and it's burning, and you do an endoscopy and they say it's gastritis, you kind of have to ask, well, what type of gastritis is it? And then also, what is this gastritis caused from, right? You know, one thing we didn't bring up is that if you have low stomach acid, you can have gastritis, but if you also have too much acid, right? So that's if you have reflux and heartburn and you have too much acid being produced, you can have gastritis as well.
That's quite interesting. So let's bring it down home for people who don't understand the whole process. So I'm sure many people have heard about leaky gut. Does gastritis fit in that context of leaky gut as well?
I think it does. It does. So if you've got leaky gut, meaning this is now happening in your small intestine, there's inflammation, there are changes in the microbiome of the gut, that can cause inflammation anywhere. And I always tell patients, you know, it's like the whole GI tract it's not isolated. So sometimes the people will be like, oh, I'm feeling something here, or I'm feeling something here. Remember that from mouth to anus, it's one long tube, really.
That's true.
There's crosstalk. So often when we find issues in the colon, you're going to find issues in the upper GI tract as well. So you kind of, this is the, you know, kind of the concept of functional medicine as well, right? As we know, looking at the body as a whole instead of just different sections to everything, right? So anything going on in the small bowel can absolutely affect
the upper gut as
the
well.
upper gut, And cheers to gastritis.
Cheers to gastritis. Here we go.
It's Friday night, guys. We're just letting loose. It's been a long week.
Very, very long week.
Oh, it's been a really, really long week. We hope you guys are enjoying. You enjoy this session of Tummy on Fire. We talked a lot about gastritis. We're going to make it short because we got to continue our sort of our little chit chat girls night out. So we're going to say thank you for joining us tonight. Please leave a like. Please shed some love. This is Gut on Fire. Dr. Vivian Asamoah. My practice is in Katy, Texas. I'm a gastroenterologist and a functional medicine provider. I am accepting new patients, and I took on this goddamn darn challenge of a Facebook Live every day, rain or shine, at 9 p.m. I'm going to be talking about a different topic every night. Tomorrow, I think I'm talking about leaky gut, but I'm not too sure.
Oh, okay.
I must be talking about leaky gut.
You need to get me on that as well.
Oh, you want? Okay, you can join me tomorrow. I wanted to show off my Ghanaian flag. Here we
that's
go. So I'm originally from Ghana, West Africa, and one of my wonderful staff partner in crime, Michelle, who makes this with actually her family and her husband. This is actually made of wood, and she actually made this for Christmas. I was so impressed. This beautiful flag for me, which everyone in the house right now is fighting about where it's gonna go. Yeah, my son wants in his room.
It's a beautiful spot.
Yeah, I could put it right there.
Yeah,
I could put it right there. Yeah.
Very, very
Have a
nice.
wonderful weekend, guys, and thanks for joining us tonight. Thanks for
Bye.
joining us,
Sure,
PK. Thanks for
it's been
coming
a
on
huge
tonight.
pleasure.
Thank you.